Health Chat is sponsored by Buell Regional Health Foundation.
Heart disease describes a number of disease processes that affect the circulation of the body, including the pump that is used to push blood around the body. So if we think of your heart as a house, it has electricity, it has doors, it has windows, and in our world, those are valves, those are arteries, those are electrical wires, and heart disease refers to any of those disease processes that affect heart structure. More women will die from heart disease than anything else. Every form of cancer added together doesn't come close to killing as many women as heart disease. And a lot of people are unaware of that. We minimize our individual risk. So it's extremely important to be aware of what the number one killer is and how do I help to modify my risk of that happening to me. So it's really important to support your heart health in your daily life because this disease develops over time. We know that there are risk factors: diabetes, obesity, lack of exercise, high blood pressure. Being postmenopausal actually increases our risk. It's a unique female risk factor. Also, any female who had a complicated pregnancy, high blood pressure during pregnancy, preeclampsia where they had extra fluid during pregnancy, if you had diabetes during pregnancy, you are 33% more likely to have cardiac disease later in life. So understanding your risks and knowing if I don't smoke, if I exercise, if I watch my weight, if I eat healthy, we can modify every risk factor except genetics that contribute to this disease. I tell people what you eat is everybody's most common medicine. Eating things that are very high in saturated fat increases the amount of inflammation and fat deposits in your bloodstream. Excessive sugar and carbohydrate intake, especially simple carbohydrates, one of our biggest contributors. Over 90% of diabetics will develop heart disease. Here's how you know if you're eating too much sugar or carbs. As we age, we tend to carry our weight in our bellies. That's a sign of insulin excess in the body, primarily driven by our bodies having a hard time metabolizing carbohydrates and sugar. Decrease the amount of sugar that you take in. If you drink regular pop, switch it to something else, change to water. Decrease the amount of simple sugars, desserts that you're taking. You don't have to eliminate them, but if you're having something for dessert every day, say I'm going to do this once a week. If you're doing it once a week, say I'm going to do it every 2 weeks. Also, I would tell people we need to find a way to move, whether that's 10 minutes 3 times a day, whether it's taking the steps. And I also think during Heart Month, I want women to reflect on stress is also a very big determinant of the development of cardiovascular disease. We know that. And people have obviously been under an inordinate amount of stress for the last 2 years. So ways for people to think about how can I replenish myself? What can I do to try to manage the stress in my life a little bit better? Since 1984, more women have died of heart attacks than men. So why do more women die? Because they are later to present. They come to the hospital late because they think something else is going on. Our most common symptoms are shortness of breath with exertion, sudden onset of chest pain that radiates to the shoulder or down the arm, sudden nausea, so chest pain with nausea, pain that radiates through to the back, especially if this is a symptom that you might have noticed when you were doing things and then when you stopped it went away. The pattern of the symptom is just as important as what the symptom is. If I have jaw pain when I'm carrying a clothes basket up the steps, but I put the clothes basket down and my jaw pain goes away, that's not because something's wrong with my tooth. The context and the pattern is extremely important. So if you walk to the mailbox every day and on Tuesday you go to walk to the mailbox and you notice that halfway there you have an aching chest pressure and you stop and it goes away, that needs to be checked out. And don't be afraid that they're not going to find anything. It's great if we don't find anything. But the only people who know what a heart attack feels like are somebody who's already had one. Women have a higher incidence of atypical symptoms, nausea, vomiting. The second most common symptom in women who are suffering from a cardiovascular event is fatigue. Most women are fatigued every day. So it's a pattern. If something changes, especially if it's related to exertion, it should always be checked by your physician. Heart health is something that we need to embrace because it's modifiable. As long as we address our risk factors and we lead healthier lives and we recognize the disease when it's happening, nobody has to die from this. And people can live well into their 90s and on with heart disease. The problem is finding it, diagnosing it, and treating it. So we need to do everything we can to identify it and then to make changes, however small, to help our overall cardiovascular health, like not smoking, making sure blood pressure is under control, regular exercise, normalizing our weight, our sugar intake. They're things that are very doable and will pay off in the long run thousands of times over.